and Dr. Shah from Harris County Health Department and his deputy, and Dr. Porsa from our Harris Health System. As you know, we're here. I wanted to provide an update on the situation. I know folks are nervous after the news yesterday about the case, the presumptive positive case in Fort Bend. And as you guys know, on Monday, we stood up our Office of Emergency Management. We activated to level 3, which is increased readiness, and we activated the Emergency Operations Center right here at TransStar, where we now have our partners physically together. And so I wanted to share what we have been doing in terms of that activation and supporting Fort Bend, as well as what folks can do given the current situation. We just came out of a meeting with a range of partners where we've been exercising the scenarios we've been planning for. So we have had plans for months that we've been updating, going to what would we do if such or another scenario were to occur. And so what we did today was run through those different scenarios with our partners, from our healthcare and public health departments to our engineering department, human resources, the different City of Houston departments, the network of hospitals, different folks who would become key players in the event of a response or the need to ensure continuity of government operations. The way we're thinking about it is just like you look at the economic supply chain, hospitals, our health system has its own supply chain in a way. Folks who have come in with strokes and heart attacks and different forms of cancer. And we have to make sure that our community is as ready as it can be to continue responding to that for our government, our hospital systems, and all the different parts of our community to continue moving as it needs to, while we also respond to a possible case. And so what we did and we're continuing to do is really exercise that muscle memory of what a response would look like, check our egos and our logos at the door, and all work together, very closely together, in what exactly our roles are and identifying any gaps. So that's also what we've been discussing. The broader posture is, first of all, we want to continue monitoring the situation. We are in a moment of containment with this case, right? And so if we ever get to a place where we don't know where positive or presumptive positives are coming from, how they got infected, and those kinds of issues, that's a different situation. That would mean, coronavirus is out in the community and we don't know how it's spreading. Right now, we know the origins of this one case. We have other cases that we're testing. Eventually, the reality of it is one of them is going to come back positive at some point. But all of the cases we're testing right now, we know the origin, and we are contacting any folks that are involved in those cases to try and contain. And so for now, we have to remember, the flu has killed 10,000 people already in the United States this season. Coronavirus, we're at 11. We are at a point where this is contained. We still haven't had a case in Harris County, and we are preparing as best possible for if and when we do, to make sure we share that with the community. As far as the case in Fort Bend, Dr. Shah, Dr. Person, part of the City of Houston, they were both in Fort Bend County last night. They've been in constant communication with those folks. Mayor Turner couldn't be here today, but we are always in touch with his office. Same with County Judge K.P. George in Fort Bend. I've been in direct contact with him as well. And we're providing technical assistance. We recognize that these cases don't respect political boundaries. And so we all have to stay in close touch, make sure that we're coordinating also through the state health service region that encompasses all of our jurisdictions. We're working through them. And so we'll continue to provide that assistance. As far as what else we need, we know that funds are coming down from the federal government for coronavirus response. We have to make sure that those funds arrive to boots on the ground, to us here at the local level, and they don't just stay, at higher levels of government. We're the ones that are going to be doing the testing, the city is. We're going to be responding. We're going to be protecting the community. And so we're working with our legislative delegation right now, our congressional delegation, to help make sure that we get those funds. In terms of what folks can do, right now we're still at a point where we need folks to be vigilant. Help us do your part. So wash your hands. I've noticed a lot of people trying to avoid shaking hands. That's great to the extent that we can try and keep ourselves and our surroundings as hygienic as possible. Washing hands, sneezing and coughing into a tissue, not into our hands. If you are sick, please don't go to work if you can help it. For any employers out there, this is the time to begin thinking about, if we ever got to a position where we had more cases and we had to, ask folks to stay home, how would you do that? Those are the kinds of conversations we're having. So for employers out there, that's something you can begin thinking about. Would my employees be able to work from home? What would my operation look like? Right now, though, we are at a preparation period. We are at a containment period. We still don't have a case. Everyone is taking the necessary precautions, and we are all working very closely together to make sure that we can respond adequately. I'll repeat the remarks in Spanish, and then we'll make time for questions from the different folks here behind me. En español, sé que la gente está preocupada y nerviosa después del caso en Fort Bend anoche. Quería hoy explicar lo que estamos haciendo aquí en la Oficina de Manejo de Emergencia. Como saben, el lunes activamos la Oficina de Manejo de Emergencias. Tenemos aquí el Centro de Operaciones ya activado con el personal trabajando día a día, todos juntos en TransStar para poder responder. El día de hoy, esta mañana, acabamos de terminar un ejercicio con docenas de miembros del gobierno y otras organizaciones, planeando cómo respondemos, practicando exactamente cómo implementaríamos los planes que hemos venido diseñando. Como saben, por ejemplo, los hospitales, ellos reciben pacientes día a día que tienen cáncer, un ataque al corazón, temas que no van a detenerse con este virus. Entonces tenemos que asegurarnos que nuestros sistemas de salud y también los sistemas del gobierno puedan continuar funcionando aunque comencemos a ver casos en el condado Harris. Hemos trabajado con los distintos hospitales esta mañana, con los distintos departamentos, con los departamentos de policía, al igual que la ciudad de Houston. Tenemos aquí el director de salud de la ciudad de Houston y hemos estado en contacto con el juez del condado en Fort Bend, con KP George. Entonces, en este momento se trata de monitorear, de planear. En cuanto al caso en Fort Bend, hemos estado apoyando a ese condado. Anoche mi director de salud pública y también el director de la ciudad de Houston estuvieron juntos hasta tarde con los oficiales de Fort Bend, yo también por teléfono con el juez del condado allá, apoyándolos y asegurándonos que todos estamos trabajando en conjunto, porque sabemos que estos casos no respetan las líneas políticas. Estamos trabajando con el estado de Texas en nuestra región que nos corresponde para todos coordinar. Lo que hicimos el día de hoy es realmente olvidarnos de los títulos, olvidarnos de los egos y todos trabajar juntos en planear e identificar cualquier debilidad que podamos ver a futuro. Hoy en día seguimos en un momento de contenimiento. El caso que se identificó, sabemos de dónde vino, no es un misterio cómo esa persona se infectó. Las otras personas que estamos evaluando, estamos esperando que regresen los resultados. En algún momento habrá un positivo, pero por ahora todas las personas que se están evaluando, todas son personas que sabemos cómo pudieron haber sido contaminadas. No hay ningún caso misterioso y todos han sido informados de su posible situación para que se alejen de la comunidad y no haya la posibilidad de infectar más gente. Entonces hay que recordar que la gripe ya ha matado más de 10,000 personas esta temporada. El coronavirus vamos en 11 en los Estados Unidos. Entonces en este momento todavía no hay, está contenido, no hay casos en el condado Harris y es momento de seguirnos preparando para los empleadores, gente que maneje una empresa, un negocio, empezar a pensar si nos viéramos afectados, ¿podrían mis trabajadores trabajar desde casa? ¿Qué haríamos? Y para los individuos, todos en la comunidad, seguirnos lavando las manos, tosiendo, no en las manos, si están enfermos, no vayan a trabajar si pueden, y nosotros seguiremos trabajando por todos. En cuanto recibamos un positivo, se le informará a la comunidad. So those are my prepared remarks for now. I'll open it up for questions, and for me or any of the experts here.
Still no confirmed or presumptive positive cases in Harris County.
That's right. As of right now, still no confirmed or presumptive positive cases in Harris County.
What about the cases tied to Rice?
So all of those cases the cases tied to Rice are being tested. We can't, as well as other cases, as we've done thus far, we don't want to create panic. We don't want to frighten people from coming forth and saying they may have a potential case, that they will be exposed. If they say they're feeling sick, they might have coronavirus. And so until we get a positive or a presumptive positive, all of these cases are right now persons under monitoring, persons under investigation. What we are doing, and Dr. Shah can speak more to this, what we are doing is making sure that everybody whose test has been sent out, that they're, and everybody who we know is connected, maybe connected to issues where we say, there's a chance that they could be infected, like this trip and any other issues we've received, they're aware. And so we're asking them to self-quarantine. We're not waiting for the result to come back to inform folks of, it may or may not be positive, so we need to begin taking precautions because we don't want to get a positive and then say, oh, these folks should have been, trying to keep distance from the community.
Ballpark number, how many people have you asked to self-quarantine? I mean, are we talking dozens? Are we talking hundreds?
Yeah, so Dr. Umair Shah, Executive Director of Harris County Public Health, I want to thank Judge for her opening comments, and I also want to thank her for the leadership she's provided to bring all of us together as partners here, both from a health standpoint, but actually more importantly from all of county government and our partners at the City of Houston and other regional partners, including in the private sector. Dr. Peirce and I were yesterday, as the judge mentioned, in Fort Bend County supporting our partner colleague at Fort Bend County, Dr. Minter, and we are really, this is, I think, the key message we want to make sure everybody knows is that government is doing everything it can, not just within county government or city government, but across this region, that the elected officials, policymakers are connected, but so are the public health departments. And so I want to just make a couple of comments just so we can clarify some things. First is that we do not confirm, and their judge has already made this comment, but I do want to make sure to emphasize it. We do not confirm rumors and myths. What we confirm are actual test result positive. When we have a confirmation, in the case of yesterday, a presumptive positive from, and Dr. Peirce can talk about the laboratory aspect of this situation from Fort Bend County as well, but when we have a situation, and these are not cases, these are individuals. These are human beings, right? These are individuals who have, because they may have traveled somewhere, may have been exposed to the virus in another part of the world, have come back to our community. Our epidemiologists, our public health practitioners need to be able to do their job to investigate who they, first of all, their status, how they are, what's going on with their individual care. Number two, to make sure as quickly as we can, and there has been a lag, and we know that from the federal government in terms of testing capabilities at the federal level, to get those individuals tested and get those results as quickly as possible. But the judge is absolutely correct that we have been treating individuals who we think may be suspicious or highly suspicious of potentially turning into a lab-confirmed case, we've been doing everything we can to contain. We've been doing everything we can to do the contact tracing to understand where those individuals may have been in contact with others, especially close contact, where the other individuals might be at risk for also novel coronavirus. That's what our job is, and that's what our public health departments have been doing. Our department has been up now for 66 days with response activities, and we hadn't even had a first confirmed case in Harris County. So I just want to make sure that our community understands what public health does every single day when it comes to tuberculosis, when it comes to influenza, when it comes to even novel viruses. This is what we do when we investigate. And so we are not giving information in terms of numbers of tests or numbers of individuals. Right now what we're saying is that it is not as high as you had mentioned. It's a few, and we're working across the region to make sure we do everything we can to protect the rest of our community, but also to protect the privacy of those individuals.
What does the science say about how this is spreading? It seems like, this has been spreading kind of violently in the country for a while. What's the reality? What does the science say about how this?
Yeah, so let's talk reality. So the reality is that we have been watching, and if you look right over there, there is a map right there that is on our Harris County Public Health website, and you see that there is a lot of information there in terms of what's happening globally. And the science is that what was happening in Asia, in China specifically, was all the measures to really contain what was happening in Wuhan, and then Hebei province, and then obviously in the rest of China. That containment strategy worked to some degree because it obviously allowed time for delay, if you will, for additional cases in other countries, but we recognize the interconnectedness of the world, that you were going to start to see cases elsewhere. The science has evolved in that we're learning more and more about this new virus. So the reason that it's a nuanced message, we are concerned about the flu. We know the influenza kills people every single year, and that is the case right now as we speak because we are still in flu season. But we also are concerned about a new virus that made a jump from animals to humans. And we would be foolhardy if we did not share that concern with our community. The science is saying that there is potential for person-to-person, human-to-human spread, and that is what we're seeing, obviously, in other countries around the globe, but we're also seeing that in the United States. Outside of Seattle, where we have a localized outbreak in Seattle, especially at a long-term care facility, and the 3 cases that we're talking about on the West Coast, the situations around Oregon and in California, and obviously some concern about what's happening in other parts of the country, there is now additional potential for community spread. We are not seeing that here locally, but that is exactly what we are preparing for. We hope we never get there, but we want our community and our partners and all of government to keep that in mind and do everything we can do to protect our community from that potential for community spread. But, and this is a really important mention that the judge, message that the judge said, Dr. Porsa mentioned, Dr. Persas mentioned, and all of our team members, our community should be prepared for additional cases. That may happen today. That may happen tomorrow. That may happen a week from now. Our community should be prepared that we are going to be back up here and having very transparent discussions and announcements to say we have an additional confirmed case, whether it's presumptive positive or it's a confirmed case, because that's the nature of the evolution of a would-be potential pandemic, and that's what we've been seeing around the globe. And so we want to make sure that we get that clarified as well.
One point, and
Sure.
I know you guys have more questions for Dr. Shah, but one thing that's important to highlight to your question about about the science. Is we saw, for example, in Seattle, there were cases that were diagnosed, and then once they were diagnosed, they were tied to all these other folks in the community. And so what these folks are doing day and night is anyone who could potentially be diagnosed, as Dr. Shah mentioned, is really investigative work, trying to figure out who they are and who they've come into contact with, and informing all of those people, like, let's hope you are not a positive, but if you are, we're going to do everything we can. And some of these folks are in other counties, and so we're speaking with the other counties and saying, hey, you ought to go follow up with these people and make sure that they know, to stay away from folks. So we are really asking every question about how can we do better, how can we learn from the what's happened and the lessons that we've taken from other jurisdictions that in a way are a little bit in the future from where we are.
I wanted to have Dr. Peirce address the lab. I think there was a question about lab, so I would like to have Dr. Peirce address that, including capacity issues. Dr.
Thank you, Judge Addo, and thank you, Dr. Shah. So the City of Houston lab, as of today, does have the ability to do some limited testing. The advantage that gives us is that we will be getting answers much more quickly than we have up until now, when the samples had to be sent to the CDC, and there have been a several-day lag. So we'll be getting the results of tests. We're going to be telling folks in about 24 hours, and the reason we run it takes hours to run the test, and so we'll start with the batch that we have in the morning. By the end of that day, we'll have the results, and during that same time, we'll be taking in samples throughout the community that would be run the following day. So it's going to be about a 24-hour turnaround, and that will continue to be the case up until our lab has more samples coming in than we can run in a day. And so it's really important that the public understand that we will need to prioritize that. So, for example, people who are seriously ill and in a hospital and the doctors can't find another reason for their illness, obviously we're going to test those folks first. And there will be a prioritization scheme down to the folks that have no epidemiologic link, they have no travel, they haven't been around anyone who's sick, they're not sick, they're just scared. When we don't have the capacity to do all the tests that come in a day, well, certainly the people who meet that criteria would be last in line. In addition, we will be doing tests that the test has to be ordered by a practitioner, by a doctor or a practitioner. So you won't be able to just come up to the lab and say you want to be tested. There has to be a reason for you to be tested. And I'm counting on our medical professionals in the community to not submit tests for people who have no risk factor, no symptoms, no reason to be tested other than they're simply concerned, because we have to maintain our testing capacity for the people who actually do have risk factors or who are acutely ill. And that goes to a point that Dr. Shah and the judge made. The judge used the right term. This is about containment. And so as we get cases that turn out to be positive, or even the ones that we are concerned have a high risk, we are, as Dr. Shah described, we are getting in touch with those folks and trying to make sure that we minimize, if not eliminate, their movement within the community. In an ideal case, they will stay at home in their bedroom and not go anywhere until either their quarantine period is over, or if they are someone who's being tested and being kept at home, that we get the test results back. And this is really important because you all reported, you all saw what happened in Wuhan. And when in Wuhan, the epidemic erupted at such a pace that it overwhelmed their healthcare system. Wuhan didn't see this coming. Wuhan had no advance notice. We have advance notice. We have this time right now for the public to be educated on the things that we are doing, and just as importantly, on the things that the public can do. And so we've talked about these things, and I'm going to say them again, and we will keep saying them. Cover your cough with a tissue and throw that tissue out. If you don't have a tissue, cough into your elbow. Do not cough on your hand. Wash your hands frequently. Washing your hands is better than using hand sanitizer. If for whatever reason you have hand sanitizer and you can't get to a lavatory to wash your hands, that's when you use the hand sanitizer. Please don't use hand sanitizer instead of washing your hands. We're going to run out of it, and it's not as effective. It's very good, but it's not as effective as wash your hands. And very importantly, if you are ill, don't go to work. If your child is ill, please don't send your child to daycare. Don't send your child to school. This is why employers have sick time, and so the employees can stay at home. This is why these things are in place, so that we can minimize the spread of a virus throughout the community. And I want you to imagine a graph. And on the vertical axis is the number of people who are sick, and on the horizontal axis is time. In Wuhan, what happened was they got a lot of people very sick very quick. And it spiked very high, and we saw all this on the news. And it overwhelmed their healthcare system. If we do our containment strategies from the government side, and individuals do their containment strategies, their personal hygiene things we've talked about, we can flatten that curve. And we can keep that peak at a much lower level. You know, in the end, quite honestly, that may make this thing drag on a little bit longer, because it's a virus, and snuffing out a virus is difficult, so it may carry on longer. But what's important is the peak doesn't get to be above the capacity of our healthcare system. Then there will be a hospital bed available for everyone who needs a hospital bed at the time that they need it. And we won't have the situation that the folks in Wuhan fell victim to, which was this huge spike that overwhelmed their healthcare system, such that they had to build several new hospitals very quickly in order to try to catch up. So the point that I'm trying to make is that we have a responsibility to do things that we're talking about. This is identifying cases, identifying possible cases, people who've got risk factors, and trying to get them to quarantine themselves and isolate, and all those things that we've talked about. But just as importantly, the public is empowered to protect themselves with these things that we keep talking about over and over again. And the public needs to understand that we can't do this all on our own. And if you think about it, and I've said this before, if you think about the other epidemics that we've had in the last couple of decades, SARS, MERS, even Ebola, those epidemics weren't stopped because of a vaccine. They weren't stopped because of a magical pill that was given in the hospital. Those were stopped because people started following the public health containment strategies were put in place. They were aggressive, and just as importantly, people started paying attention to their personal behaviors. And especially in the case of Ebola, and you all reported on this, especially in the case of Ebola, that epidemic in West Africa was out of control for a much longer time than it needed to be, because people didn't believe what the public health folks were telling them to do, and they continued to care for the seriously Ebola sick folks at home. They continued on with some practices which were cultural, but in how you prepare a body for burial, and all those things were causing the ongoing spread. It wasn't until the public started listening to the health from the public health, started listening to the advice from the public health professionals, that Ebola outbreak stopped. That's what stopped it. It was actually the people who stopped it. And so this is how outbreaks are, and this is how viruses spread, and this is how we can stop them. We do it as a community. Thank you.
Yeah.
How do you identify it? Let's say I feel bad. I went to the rodeo, March event. I go to my doctor because I feel bad to see how, at that point, how does it get identified?
Yeah, thank you for that question. I think this is a challenge where we have a lot of Google Docs out there, and we want to make sure that we really have a strong chain of people patients, individuals in the community, would be patients, maybe they're not diagnosed yet, but that there is a connection with the healthcare system. And we want to make sure that people are connecting with their healthcare provider, their doctor, their clinic, their usual place where they're going to be able to get healthcare services. We know that's a challenge in our community, and that's why we have Dr. Porsa here with Harris Health as well. I'm so proud of having Dr. Porsa here. He's a colleague of mine. We trained together years ago, and he returns now as the CEO for Harris Health System. We do have this challenge where we have a lot of people who don't have a usual place where they can go, and so they use the emergency department, unfortunately, as that usual place. And as Dr. Peirce mentioned, that's absolutely the wrong place where we want people to go. What we want people to do is to make contact with a healthcare provider, or at least a contact with some sort of health system. All of our health systems have some way of fielding a question by phone, at least some way to do that. Once they go and get connected to that healthcare provider then, if there's concern that this individual might have something more than just the common cold or seasonal flu, they would make contact with the public health department. Then behind the scenes, and this is why it's so critical that our community understands this, all of the health departments are in communication so that we can share across jurisdictional lines and determine who's going to follow up, who's going to monitor, who's going to do all the different things to work with that healthcare provider, that healthcare system, in order to be able to determine whether this individual is somebody to be concerned about for this emerging disease. Otherwise, really, we don't want people to just diagnose it on their own.
And let me remind folks, so it's very important that if folks, feel they've come into contact with someone who may be infected or they're sick and they've traveled somewhere, they think they're at high risk, that they come forward and call their health professionals. So we don't want folks who are uninsured to not call. If you dial 211, they can refer you to hospitals that will serve you without insurance. The test right now is at no cost, and we are working. Part of the discussion today is how can we work to maintain that, even if we were to need more tests. And if folks are undocumented, same. They can go to any of our Harris Health hospitals and call our Harris Health hospitals, and these hospitals will not ask whether or not you have documents. Sí, necesitamos que toda persona que sienta alta posibilidad de ser afectada, que haya estado en contacto con alguien que haya viajado a estos países y se sienta enferma, que no tengan miedo de contactar a su médico. Entonces, si no tiene seguro, puede llamar al 211, lo referirán a hospitales que lo reciban sin seguro. El examen del coronavirus no tiene costo y estamos trabajando por mantener esa situación. Si no tiene documentos, puede llamar a cualquier hospital del sistema de Harris Health. Los hospitales públicos del condado son muy buenos y todos no le preguntarán si tiene papeles o no. Entonces, lo importante por ahora, obviamente, si el doctor no evalúa, no le parece al doctor que usted esté en alto riesgo, pues tenemos que darle prioridad a las personas con más alto riesgo. Pero necesitamos que toda persona que sienta que pueda tener alto riesgo de tener este virus, llame a su doctor. Sí.
En español rapidito, lo que él acaba de escribir es un poquito, él lo dijo, challenge, es un reto bastante fuerte. La gente se le va a hacer muy complicado estar llamando por teléfono cuando usualmente se va al doctor o se va a una clínica donde hay mucha más gente o al hospital de emergencia. Entonces, decirle a alguien, no, llame por teléfono y si vemos que tiene los síntomas, nosotros vamos a tomar control. Es como que, ¿cómo se le dice a una madre, por ejemplo, que tiene un hijo muy enfermo y que tiene que llevar a su hijo de emergencia?
Sí, pues, o sea, si alguien tiene síntomas peligrosos, pues obviamente estamos trabajando con los hospitales. Si alguien llega a un hospital, algo que tengan que estar hospitalizados, pues se está trabajando para que los hospitales tengan áreas donde tendrán personas con coronavirus que también necesiten estar bajo observación de hospitales. En este momento, las personas con alto riesgo de recibir un positivo no tienen síntomas peligrosos, la mayoría, entonces están en casa. Ahora, lo que sí pedimos es, si usted siente que tenga posibilidad de que tenga coronavirus, y si él es posible, dada su situación, llame en lugar de ir. ¿Por qué? Porque al presentarse a una clínica con muchos pacientes, si usted sí tiene el virus, puede contaminar a la demás gente. Entonces, eso ya va a cada persona que nos ayuden con eso, que llamen a su doctor, le informen los síntomas y ya el doctor evaluará si es simplemente un resfrío normal o una gripe temporal, o si puede ser coronavirus. Si le parece al doctor que pueda ser coronavirus, nos contactarán a nuestro departamento y los departamentos de salud pública trabajarán entre sí para definir los siguientes pasos.
Is there any information on the U of H students who are self-quarantined? And two, there have been some Metro bus drivers who tweeted at me and asked the concern because of the many passengers that they transport to answer those questions.
Yeah, thank you for that. Regarding U of H, I do not have specific information, I'll be honest. We also received, again, through the media, so thank you. We also received information related to that situation. Our City of Houston partners, Dr. Purses has had to leave, but the City of Houston, my understanding, is following up in that situation. Our epidemiologists at Harris County are also in connection with the City of Houston, but I don't have an update on that. As far as the Metro bus drivers, I didn't catch that.
They transport lots of
Sure.
people throughout the course of the day. They want to know what is the possibility for them, the kinds of measures that they take.
Sure. And I think this is I am so glad you asked that question, because this is exactly the message we want to get to the community, is that right now, as we speak, the risk to our public is low. So unless you are doing something different than what Dr. Purse said, which is cover your cough and make sure if somebody is sick around you, they're coughing at you, that you try to move them away or move away from them, and that you wash your hands and use, soap and water first, hand sanitizer as an alternative, and obviously if you're sick, you stay away from other settings where you might get somebody else sick. There is no change in that message. What we saw from yesterday's situation with Fort Bend County, or what we may see with additional cases as they get confirmed over time, that message right now remains the same. Go about doing your work. Go about going to school. Go about doing all the things that you have to do in order to live your life. And when we believe that the risk changes, we're going to come back and let the public know.
Let me address that point. Just came up when we were having our exercise about our public transit, and so we are, of course, in touch with Metro and with the different ride services that Harris County provides as well, to ensure that were this ever to get outside of the containment phase, as Dr. Shaw said, because right now all of this is contained, we're not at a point where we need to ask people to not go places, right? But we do want to prepare for that, and we are working with Metro and with other folks, law enforcement, for example, which comes into contact with a lot of people. They're still out there normally, but we'll be cleaning things more frequently, and we'll be planning for if this were ever to become a bigger issue, what steps would we be taking. So it's absolutely something we're working on.
Any comment just on
Yes.
the kind of mixed messaging, even from the president last night during the interview, kind of downplaying the risk and questioning some of the World Health Organization's data? People hear different officials say different things. What is your take on that?
Listen, we're responsible for the community. For me, the most important job I have and we have is the safety of the community. So we're looking at the data, we're looking at the science, we're speaking with the researchers, the epidemiologists, the other jurisdictions that have faced this, and we're making decisions accordingly. So everything we are sharing with you is facts, and we will not and are not hiding anything. As soon as we get a positive, we will share it. As soon as we have next steps, we will share those. We have a network of professionals, doctors, scientists, all working together to make sure that we make decisions based on the best science.
Earlier, Dr. Purse had mentioned something about MERS, SARS, swine flu, bird flu. Can that cause some people to be lackadaisical? We lived through that. Everything was fine. Everybody blew it all out of proportion. And now we have another one that's going to be fine. Does this fall into that category, or how does that? Or is this a totally different animal than any of them?
I think early on with all of the different diseases and epidemics or potential for a pandemic, right? So that was the concern with, again, SARS in 2003, 2004, with MERS that was in 2013, 2014, 2015, and then certainly H1N1 during 2009, 2010. The concern early on is we don't know enough, and let's try to work to what we need to do. The strategies that worked for SARS and MERS were actually what Judge mentioned, containment. Containment is actually what got us through SARS and MERS. Now, there were obviously some bumps along the road. This is not like you have a playbook for every single scenario around the globe. So that is important to remember. H1N1 did become a pandemic in 2009, 2010, but turned out it was mild pandemic. So it was geographically spread, but it was a mild pandemic. So I think your point about potential complacency, or people say, yeah, I've heard that message, I don't need to worry about the message, is absolutely the wrong action to take. There are things that we need to do every single day to protect ourselves from just the common cold and seasonal influenza and the flu that we do not take. And I shouldn't reveal this. I mentioned this in private to the judge, but when I was 6 years old, my son's about to turn 6 in about a week, I was one of those people that would be just the avid hand washers, and not only the avid hand washer, I would also make sure that others in that house were like, did I hear the water come on after you used the restroom? To make sure that they also wash their hands. So obviously now I'm a public health practitioner. That's why, because I won't reveal the age, but 40-some years later, here I am saying, wash your hands, do the things, don't be complacent. So yes, I think there is a tendency that we have sometimes even with hurricanes. We've had a storm, we got through a storm, we don't need to worry about the next storm. But this is the situation we have here, is that this is an emerging disease, and until we know more, yes, we need to do what we have to do to protect ourselves, and certainly to keep in mind how to protect our entire community.
Thank you all so much. Appreciate it. Thank you.
Thank you.
Yeah.
These elevators.